I'm Dr. Stephen Zimmet. I'm in private practice in Austin, Texas. My practice consists of phlebology, which is the treatment of venous disease, and procedural dermatology. I'm a longtime member of the American Academy of Dermatology and the American College of Phlebology, and I have received leadership awards from both organizations. I'm currently the founding president of the American Board of Phlebology and work as an editor for Phlebology, the Journal of Venous Disease. I am past president of the American College of Phlebology and was their founding chairman for their foundation. Lastly, I am a medical director for drqa.com, a patient education portal that is seeking to provide credible information for patients and increase the awareness about venous disease. People with spider veins, of course, want to know what treatments are most effective for their veins. There are two basic options. Laser treatment, where we're delivering laser light from the outside onto the spider veins. The other is sclerotherapy, which involves using small needles, making injections into the veins. And the goal is the same with laser and sclerotherapy, which is to get those veins to seal off, shrink up, and disintegrate. I like lasers and use lasers every day in my practice, but for leg veins, most experts really agree that sclerotherapy is the most effective treatment. So now let me talk a little bit about what's involved in sclerotherapy. The patient will be lying down. We cleanse their skin with some alcohol. We use very small needles. I mean, it is a needle, not a massage, but they're small needles, so most people find it not a big deal to go through. And we're making injections into the veins with the goal being to get those veins to shrink, collapse, and go away. A treatment takes generally between 20 to 30 minutes. When we're done, people will wear compression stockings usually for about 3 to 4 days. We do want them to be up and active aerobically, walking or biking or treadmill. In fact, we have them walk on a treadmill for a few minutes right after treatment, which I think is good for their veins. We ask them to avoid certain things, such as hot baths, heavy weightlifting, and long travel for several days. Now, it's important to understand that it takes several weeks to see the full effect of the treatment, so I recommend that people give it at least a month and that we wait about that time or longer to do next treatment. And that brings up an important point. It's typical for people to require a few treatments to get maximal clearing. So most people might need between 2 to 5 treatments depending on how many veins they've got and just how responsive they are. The other thing I'd like to say is that let's say we clear all of the veins that you have now. It doesn't mean that you won't have other veins in the future. In fact, we would expect that. The analogy I like to use, it's a bit like weeding a garden. We can do some work, get things in better shape, and from time to time we'll need to do maintenance treatments in order to maintain your legs in the best possible condition.